Good morning, everybody. We're going to go ahead and get started with Children's Law Center's fourth community conversation. We're so happy to have all of you here with us today and are particularly pleased to see that so many of our Healthy Together supporters and champions are here, including some foundations who fund our work. So please let me say thank you. Without your support, we would not be able to do the necessary and critical work that we do on a daily basis. So I'm just going to make a few brief introductory remarks, mention a few housekeeping items, and then get us going on a conversation topic that we know is impacting thousands of families in the district as we speak, and we know is being exacerbated by the pandemic, and that's healthy housing issues. So first, if you have any questions at any time throughout this hour, you can go ahead and drop the questions using the Q&A function. We'll monitor these and be sure to leave time to answer the questions after we share some information. To introduce myself, I'm Tracy Goodman. I'm an attorney at Children's Law Center and the director of our medical legal partnership, Healthy Together, which is a collaboration with Children's National Hospital, Unity Health Center, and Mary Center. We're actually one of the longest operating MLPs or medical legal partnerships in the country. And each year we serve over 3,000 kids and families through this medical legal partnership alone. And I'll reground us in a minute on what a medical legal partnership is. But I also want to introduce my colleague, Senior Supervising Attorney Kathy Zeisel, who's here with us today and leads our medical legal partnership and is actually one of the district's prominent experts on healthy housing legal advocacy. So we're excited to hear from her today. Now, just to kind of ground us in what a medical legal partnership is, for those of us on the call who are new to the model, I like to think about it as basically adding lawyers to the healthcare treatment team. So, you're folding in lawyers as specialists who can solve, health harming legal needs that patients are facing. So a way I like to think about it is if during an exam, a doctor detects a heart murmur, the doctor may refer the patient to a cardiologist. Well, what the MLP model does is if the doctor detects a legal need impacting patient health, that doctor can refer the patient to a lawyer on the team. And so that's what the MLP model is all about, is kind of helping healthcare providers screen for those legal needs and then actually having a lawyer on the team to be able to send the patient family to help. So our experience at Children's Law Center is that Unity, Children's and Mary Center, pediatricians and other health care team members, they're referring families to us who are experiencing legal needs that are really impacting kids' health. So the primary areas are education and special education, access to healthcare, public benefits, and of course, housing conditions. And our Healthy Together, our medical legal partnership team is a team of 13 attorneys and investigators, a family outreach worker, and plus we have law clerks and volunteers. And we're integrated into healthcare teams across the city. Now, of course, prior to the pandemic, we were physically on site at the clinics, and now we're working with the healthcare teams remotely. Now, one of the top issues, it's no surprise given the conversations about healthy housing, but one of the top issues that our healthcare partners refer us is dealing with families who are experiencing terrible housing conditions impacting their kids' health. And it's actually over 30% of what we're handling in terms of cases and case types. And we're actually seeing an increase recently as the pandemic rages on. And when we're talking about conditions, we see our client families struggling with landlords and owners just refusing to repair despite repeated requests. So we're looking at mice, rats, roach infestations, mold, lead, heating and cooling issues, and more. And I was hoping, Kathy, that you could talk with us and share a couple of actual case examples so we can really understand what families are experiencing.
Sure. I think it's been interesting because I think during the pandemic, families have experienced very similar issues to pre-pandemic, and we'll talk a little bit, I think, later about how I think the responses have differed, but the conditions have certainly remained the same. I think the experiences have differed in the pandemic. One case that I think is pretty illustrative of cases that we get was a client living in a large project-based Section 8 complex in Ward 8. The unit had terrible mold and mice infestation. She lived there with her 2 children, had lived there quite a while actually. And when she called us, her main issues were the mouse infestation, like mice died in the corner of her child's room and just smelled terrible. The mouse infestation was very bad. And she had a terrible mold problem. Throughout her unit, the walls and floors had mold. She'd reported it to her landlord numerous times. Her son had pretty severe asthma, had been to the ER 3 times in the past several months for his asthma, needing asthma treatment. And her daughter was experiencing severe allergy symptoms as a result of both the mice and the mold. The landlord had come and dropped off some deodorizer so they wouldn't smell the dead mice and the mold, but had not done much beyond that and sending an exterminator out occasionally. Once we got involved, we ended up being able to, we did have to litigate the case, but once we were in court, we ended up being able to get them temporarily relocated while the entire apartment was remediated with professional mold remediation. So all the walls and floors ended up being torn out and rebuilt basically because the water damage was so extensive that the mold assessor we hired as part of the case determined that the only way to get rid of the mold was to actually tear down those walls and floors and essentially rebuild the apartment for her. So they came back after several weeks out of the unit that were paid for by the landlord to an almost rebuilt apartment that stopped triggering the asthma and the allergies for the kids. So I think that was a really successful case for us and really illustrated the connections between the kids' health conditions and actually the mom in that case also had asthma that was being triggered. Between the whole family's health conditions and the conditions we were seeing in the unit. And this had been a very active client trying to get it done on her own, but until a lawyer was involved, the landlord really wasn't doing anything effective to deal with the serious conditions in her unit. Another case, a lot of our cases are referred for kids with asthma. We work very closely with the Children's National Impact DC Clinic, which is the emergency room asthma clinic. And we get a lot of referrals from them where kids have very exacerbated asthma, where they're in the hospital or emergency room for asthma. And a lot of our pediatricians and other health centers recognize that close link with asthma and housing conditions. And in this other case, this family had 3 kids, 2 of whom had asthma, and there were actually just disconnected pipes in the unit that were causing water damage. Again, some visible mold and actual rotting and mildew in the floors. The front door actually just didn't even have the bottom baseboard in it. So there was gaps. The stove was broken kitchen cabinets, mice and ants in this instance. And the baby had even ended up in the emergency room as a result of some of the conditions. Sometimes in these cases with bad mice, we even see mice in the cribs of the babies, like they'll crawl through the cribs at night, which is an obvious health concern that doctors will refer to us for. This is another case where the family really had tried to report these conditions, but we often find until a lawyer is involved that not much happens. So in this instance, once Children's Law Center got involved, the landlord kind of shaped up and made the necessary repairs to the unit so that the family was able to have habitable conditions and live in that unit. So those are 2 pretty, unfortunately, common situations that we see and we have to get involved in.
I remember both of these cases, especially because, you know, when it involves a baby having to go to the emergency room, it really, really stands out. I do want to take a moment for everybody on the call to think about how, like, all of these housing conditions issues that families are experiencing are actually exacerbated by the pandemic. You know, families are spending much more time at home. You know, they're working from home or trying to work from home. Kids are distance learning. You know, parents and caregivers are trying to manage all of that, and there's less opportunities for being outside of the home. Kathy, I was wondering if you could just talk to us about how the pandemic has changed the landscape for housing conditions advocacy. Kind of walk us through that.
Yeah, I mean, in addition to what you were saying about families being at home, I think another challenge we've seen in just even getting repairs is some kinds of repairs require the family to be outside the home. So even extermination, sometimes the family just can't be there when that happens. So when we advocate, we have to think about where can the family safely be right now and maybe still have the virtual learning going on. Families can't just go to another family member's house like they could previously. The kids aren't just in school for the whole day. So on a basic level, thinking about, do the families actually want everything repaired, or do they only want certain things repaired right now? Really strategizing about what's the safest thing for the family in the pandemic. Do they want 4 different kinds of work throughs traipsing through their apartment right now, or do they only want certain things repaired and deferring maintenance on other things that are maybe less linked to the kids' health, even though they are housing code violations? So there's a lot of strategizing about how to do it and requesting that it be done safely, making sure that all repair people are wearing masks, making sure that they have the least number of people to do the repairs coming through the units, that there's notice to our families so that our families can wear masks and, you know, be safely protected. Just all of these little things that we didn't have to think about pre-pandemic, but to really make sure our families are safe, because a lot of our families have been impacted by COVID, have either had it or know people who have had it, and are really trying to be very protective. Early on in the pandemic, a lot of our families didn't want repairs at all. And I think put a lot of our cases on hold for a little while, but then the conditions got really bad. Their health got really bad from, like you were saying, living nonstop in the homes. And we saw landlords starting to say illegal things like, I'm only doing urgent repairs until the public health emergency is over. That's not what the law says. And urgent didn't have a definition. It was whatever the landlord wanted to do. And we also saw challenges where city inspectors and DC Housing Authority inspectors are only doing virtual inspections. And that made it really hard to see things like wet walls. We had an inspection recently where the unit passed inspection for a client moving into a new unit. And as soon as she got there, she put her hand right through the wall because it was so wet. But that wasn't something that could be seen in a virtual inspection. But it obviously would have been seen in person that the wall was so wet you could put your hand through it. I think the court closure and delay of cases put cases on a track where conditions just got worse for a long time because there was no oversight of cases and no new cases being heard. So that was difficult, but now it's back on track and court is reopened and cases are proceeding. So that's helpful. But it really has been, I think the biggest thing is just people being in their homes all the time and then strategizing about how to get those conditions addressed safely has been a really big change of practice for us. And us not going out to the homes to see them, but seeing everything virtually ourselves has been a challenge.
Right, and I noticed that both of the case examples that you shared with us, you know, have dealt with children in the home with asthma, and obviously the impact of these conditions on kids with asthma is more serious than with other family members. And I think many of us on the call already know this, but you know, you can see how resolving those housing conditions can help you know, better outcomes for kids in terms of their asthma and their health. But we also know through research that we did at Children's Law Center that our medical legal partnerships also decrease Medicaid costs. And we at Children's Law Center, we have a researcher on staff, Holly Stevens, and through her research, and this was done about, I guess, 2.5 years ago, that each successful intervention provided through Healthy Together to families with kids with asthma reduces government-funded healthcare costs by an average of $10,000 during the first 18 months. So like 18 months after a successful case handled by a Healthy Together attorney, there's a cost savings of $10,000. And so, you know, thinking about the cost savings and the examples that you shared, Kathy, you can think about that. It's imagining, you know, kids not having to go to the emergency room, not having to be hospitalized because those conditions are fixed. And I did want to just take a moment to really highlight something very exciting having to do with healthy housing work, is that through this, you know, our experience handling these types of cases and partnering with our healthcare community, we've entered into it's a very innovative outcomes-based contract with AmeriHealth, which is, you know, DC Medicaid managed care organization that serves thousands of kids and families in DC. I believe we have AmeriHealth on the call with us, but in a nutshell, this agreement with AmeriHealth allows for families, covered by AmeriHealth, the Medicaid managed care organization, allows for families with housing conditions like Kathy's, like you just described, with kids with asthma, to be linked with one of our attorneys to conduct this type of housing advocacy. And then for each successful resolution of the case, AmeriHealth then shares that cost savings that was shown from our research by providing a payment to Children's Law Center for that successful resolution. And we recently, in our frequent meetings with AmeriHealth, we learned that they conducted a study of that first year of our partnership, and we are just so thrilled with the results. Not that it's surprising, but it's wonderful to see it in black and white. So essentially, AmeriHealth looked at, for the families that were participating in this agreement, so basically client families of Children's Law Center with housing conditions issues, AmeriHealth looked at the inpatient visits and emergency room visits pre and post our Healthy Together advocacy. So they were looking at 9 months before we got involved and 9 months after the enrollment in the program or us providing the service. And what the results showed was that this is like the average number of emergency room visits prior to our intervention was 7 visits. And then the average number after our involvement was 1. And if you look at inpatient hospitalizations, the average number before our Healthy Together got involved was 1 visit. And then after a Healthy Together attorney helped the family, it was almost 0 visits. And, and for some families, the pre and post contrast was extremely drastic. So like you're talking about a family with a child who had to go to the emergency room 20 times before Children's Law Center got involved to 0, for example. So like these results are absolutely incredible. And of course I am like tooting our horn, our medical legal partnerships horn. But it's not just Children's Law Centers, that we are problem solving together and working together with our client families. We have to say that first and foremost, but also our medical partners and then our AmeriHealth partners. And so we're getting like these conditions fixed, or families, sometimes it's, getting them transferred to a new unit. And we're doing this one client at a time. We're reducing ER visits, healthcare costs. It's amazing. But what I want to ask you about, Kathy, and I think everyone would be excited to hear it, what would it take really to address this issue more upstream? First of all, why does a family need us, a lawyer, to get conditions fixed? And, what are we doing systemically on the policy front? Can you share that exciting news, please?
Sure. And before I jump to that, I just want to say, I think what's been really exciting about that research, as somebody who also does these cases on the individual basis, is, sometimes when you're on the ground doing these cases, you're like, I just feel like I'm putting my finger, on a hole in the dam. But the research really shows that it is making a difference for the individual families. And I think that has been, it's just been really affirming as doing the individual cases. So I think anybody on the call who's thinking about doing these as a pro bono case or has handled these, it really does make a difference for each individual family. So I think, just as somebody who's been doing these cases for a long time, it was good to see it in black and white, that for the individual families, we're keeping them out of the ER in the hospital, we're getting them back to primary care, which is a good thing. That, increased primary care utilization is a good thing for kids with asthma. That's what we want to see. And we're keeping their housing more habitable, at least during the period that we're able to follow them for the 18 months after we work with them. And that's great. And that these cases aren't necessarily, we're not going in there and necessarily suing immediately and getting a trial, but the way we work on these cases and thinking about them of how do we get them habitable housing is working. And that has been great, and was really affirming. And I'm glad that we have put the resources in to do that research. But what we've learned from, I've been at CLC 12 years, Tracy's been at CLC longer than me. And I think what we've learned and what everybody else at CLC has learned from doing these cases and seeing them over the years is that we, in addition to doing them on an individual level, we need to take what we learn on an individual level and think about how to make the system work better. And we'd honestly be happy to put ourselves out of business from doing this volume of cases and think about how to have the city do this on a systemic basis, because we need a systemic solution. Tenants shouldn't have to spend every Monday or Tuesday in court, you know, trying to fight their landlord. We need to be able to figure out how to have habitable housing for tenants where they don't have to be the ones fighting the battle. And so there's been two sort of streams that have come out of that work on a systemic level. One is thinking about how do we actually have a functioning housing code enforcement system, because we don't right now. In DC, if you were to call the Housing Code Enforcement Agency, which is DCRA, the DC Consumer and Regulatory Agency, you might or might not get an inspection. If you did get an inspection, you likely wouldn't get, nothing would happen after that, most likely. You would be unlikely to get much enforcement out of it, and you would be unlikely to feel like you were gonna get your conditions repaired out of it in any meaningful way that felt like you had your that you had a housing code compliant apartment afterwards. And that's a problem, because you should be able to have housing code enforcement on a complaint-based system. And we need a system that is more proactively trying to find bad landlords, so it's not just dependent on tenants that call. Because right now we know tenants disproportionately are calling. We know tenants are disproportionately calling from certain parts of the city where that's not where we have bad housing. So we need a proactive system that is thinking about where we know there's bad housing, that's looking at health conditions, that is considering where we already know that there is bad housing, slum housing, and putting it all in and doing some proactive enforcement as well. And I'm going to talk about sort of what that would look like in a second. And the other stream of the work is thinking about changing the housing code and making it better. And so we have come to both of those and through our work. And the way we're trying to do that work is CLC doesn't work alone. So we work in coalition with our partner other organizations, but also we've been lucky in the past few years. We had a grant called, we're actually in our second round of this, but we were part of the Build Health Challenge. We were one of 19 cities chosen in the country, where we worked with Children's National and the DC Department of Health and parents, clients, to think about housing code enforcement. And now we're in our second round and we're working on some other issues. But growing out of that, we were really able to work with some amazing parent advocates who helped us shape some of our advocacy as well. And some of the big areas we've worked on housing code and change are, we helped get a mold law passed. Prior to that, what we saw is paint trucks driving around the city saying, we'll paint over your mold. Well, if you've ever painted over your mold, you might know that's not an effective solution, because it doesn't deal with whatever was causing your mold, and the mold just comes back through the paint. So for tenants, that really didn't work to just paint over their mold. Now, thanks to that law, you have landlords if there's over a certain amount of mold in your unit, landlords have to use a licensed mold assessor and a licensed mold remediator, as you heard about in the case examples I gave, to actually get rid of the mold in a meaningful way.
Kathy, isn't the idea that mold wasn't part of the housing code before? Just, yeah, it's really shocking.
Yeah, and it's and as interestingly, the compromise on the law was that a third party had to be the assessor. And what we found is that that's been a problem, because you have to be able to hire your own assessor. So like Children's Law Center pays for assessors in our cases because our clients can't afford to do it. But it's created this unfairness in the law that if you can't afford to hire your own assessor, a lot of times you don't get remediation, because some landlords choose not to follow the law and hire assessors. So we've been pushing for that. We think the city should have licensed mold assessors, because otherwise it's not really a law that can be enforced, and it's not really fair to people who can't afford to hire mold assessors if they don't find an organization that can fund it. And also, we don't get the data from the reports. We're not seeing where mold is being found. And just yesterday, that law got its first vote passed in the council, that DCRA would have to have licensed mold assessors and would be required to cite for mold, which right now DCRA will not cite for mold, even though the law currently permits them to cite for mold. So that's a really good advancement in the legislation. We have a little bit more to do in terms of getting it funded, but it's not, I don't think that should be overcomeable, because it's just getting people licensed to do it, trained to do it. I think it would be a really good thing in terms of equity to have everybody have access to mold inspectors. And it would be good because we know that people are seeing mold. DCRA inspectors, if they do go out, do see the mold, they just don't cite for it. So this would require them to cite for it.
Seems like another good job creation opportunity as well, to train folks to do this type of inspection.
Yeah, and it would give us really great data of where, because the reason we care so much about mold is not just because it's mold, but also it's a sign of like severe water issues in the building. And like where there's water issues, there's probably also going to be peeling paint and lead issues, which brings me to one of the other things that CLC has worked on a lot in the last few years is reform of the lead bill. We care about lead a lot because, as a lot of you guys probably know, just eating a little bit of lead paint for little kids can really cause long-term permanent damage with lead exposure. And DC's lead laws are not great. They're okay, but they're not great. We really let kids be the canary in the coal mine in the current lead system. We wait until a kid is already had the lead exposure before we really do anything. So a kid has to get tested by their doctor. We already have the lead exposure that's probably going to cause the permanent damage before we really get our resources out there. So what we've been working on in the last few years is really modernizing our lead law to lower the required intervention level down to actually the CDC recommended levels. Right now, it's at 10 and the recommended level is 5 before there's a required intervention under the law, to change the lead levels in paint so that we don't actually allow people to use lead paint as much in the district, and most importantly, the part that we really are interested in is to require landlords, when they recertify to get their certificate of occupancy to be a landlord and get their business license to be a landlord, to test all of their units with a swipe test, which is just a simple wipe test to see if there's lead in the unit. And then they'd have to provide notice that there is or isn't lead in the unit and remediate lead hazards. DC just got back our federal lead money, so there is some money available to landlords who would need assistance with that. But we think it's important that people be notified that there are lead hazards, which we don't do a good job of right now, and that we test if there are lead hazards and not wait for kids to have that lead exposure. So I'm going to come back to some action items that we're hoping all of you might be able to help us out with around the lead law in a minute. Yesterday, when the mold inspector bill passed, so we had that lead law as one big law. As you may have noticed, we're in a pandemic and there's been a lot of emergency legislation that's gone through the council. And so before the pandemic, all this stuff was chugging along, but the lead law actually ended up getting broken up into a few different parts. And yesterday, a few things passed as part of the mold bill, the mold inspector bill. So changing the lead levels in blood was folded into that, and changing the lead levels in lead paint was folded into that. But all the rest of the stuff was pulled out of the lead bill and separated. I'm going to come back to that in a minute. But we're hoping that you guys can help us push a little bit on that in the new session. Going back to housing code enforcement, how I mentioned before that we really think that housing code enforcement needs to be addressed. Yesterday in the session, so we've been advocating for years now to separate DCRA and create it into 2 agencies, because DCRA is a huge agency, and over the years, like, it's taken on more and more roles, and it does regulation of everything from like hair salons to all the consumer complaints. Also, it does all the development work in the city in terms of like regulating buildings and permits, and it does housing code inspections. And that's like a teeny tiny part of what it does, and it doesn't do that part well. So we've been advocating that that part should be broken out into a more tenant focused agency so that it can be done by people who are tenant focused and done well, because it's a really critical piece of preserving affordable housing in the city and to make sure that people have safe and healthy housing. What we want an agency called the Department of Buildings, and we have proposed a structure over the years, and that was sort of a tiny piece of it was passed yesterday, not the full thing, and we don't know if that's going to go forward or not based on some budget estimates that came out with it. So that is, we'll see, I guess. But we are hoping that a more substantial Department of Buildings will go forward when the city's budget heals a little bit more. And we're looking at some other reform measures around reporting and pieces like that that can go into just trying to make DCRI do their job better. In terms of, I see a question has come up. So a question about, are we seeing landlords who don't have money to fix the conditions, and are there monies to help them fix the conditions? So that's a great question. We actually don't tend to run into that much in our cases, but there is money out there to help certain conditions. There's quite a few programs. We actually are part of a coalition called the Healthy Homes Collaborative. And through that collaborative, we work with some remediation nonprofits who work directly with landlords if they are landlords who can't afford to fix things and are willing to work with landlords to help them remediate, so smaller landlords. And so there's some city and federal money out there for things like roofs and weatherization and windows and HVAC and lead that can help with a lot of this work, as well as there's a pilot through Children's for kids with asthma to do some of the remediation that this nonprofit is part of. So there is some funding out there. But I would say in the vast majority of our cases, that has not been the issue. The money is there once the order is in there. We often see the failure to repair in I tend to put it in two separate categories when I think about it. One category, I guess 3 separate categories. One category is sometimes it's being used as a way to evict people without having to go to court. Like if you just let the conditions get bad enough, people will just leave their unit, which honestly, a lot of our clients when they call are like, I might just leave, the conditions are really bad. Sometimes we see it as a way to make money. If you don't put a lot of money into the property, you can make more money on the property. So sometimes we see that. And sometimes we see it as a way to gentrify. In some of our clinics are in very quickly gentrifying areas, and you can often sell a property. In DC, when you sell a property with tenants, the tenancies convey with the property. You can't just evict people because you want to sell your apartment building. And so we've had a few cases where the landlord's kind of like letting it run down in the hopes that it will empty out before they sell it, because you can sell an empty building for a lot more. And that's in some of the more gentrifying areas where some of our clinics are. That's quite clearly what's been going on. But we have had some cases of smaller landlords where they may not have the money, and then we've sort of helped them jointly apply for some of the lead money that's out there, or try to connect with resources if that's clearly the case. I would say most of our cases are landlords. Yeah.
I see another, sort of lighthearted question here that I will ask.
Yeah.
Well, this is my part. You talked a lot about different policy solutions. The question we got is, what's the priority systemic advocacy solution? And here's the doozy. Does DC have the political will and budget to get a functioning inspection system in place?
Wow, those are big questions. I think the priority right now, given the budget, is our lead law, because we think that we can actually get that done this session. I think without any budget constraints, I would say Department of Buildings, because we want a functioning inspection system. Right now, just for a bare bones Department of Buildings that doesn't have everything we want, that's at least $10 million. And I don't think that we have the budget for that right now. To be honest, it seems unlikely. And I think to get what we really want, that's more expensive. Probably. But we would love to think about ways to get a good enforcement system. that's still a priority. But I think what we are hoping that all of you guys can help us do is the lead, the lead bill, because we think that can actually keep moving. There's some momentum behind it, and we think it's really important to have the lead law keep that momentum and not disappear. So sort of one of our calls to action to all of you all is really, if you're interested in helping us in the next session as it restarts in January with our new council members and the old council members that have been there a while, hearing more voices than just ours on this would be really helpful, to say that we think that this is important. And I'd love to connect you with the policy staff at CLC who are working very closely on this. So if you're interested, please feel free to reach out to me after this and we can connect you. Just a call or a letter or an email to the council people, because the council staff or council members who are working on it could be really, really helpful, to say that you think this is important. You hope that it is going to come back in the new year, or, you know, that they're going to help keep it moving forward, I think would be really important in the new year. I do think we can't lose sight in the longer term of this enforcement issue, because ultimately, unless we have better enforcement in the city, this is all a little bit for naught, because we as individual lawyers can keep working for the individual clients, but we really need a system that's going to help preserve the affordable housing and preserve housing in the city on a bigger systemic level, because, you know, we're 13 attorneys, but we need to be like 1,300 attorneys to do it for everybody who needs it, I think. So.
And I think you may have answered this a little bit, but I have a question about, are you worried about landlords refusing to address housing conditions, you know, as they try to push tenants out during, you know, like during this public health crisis, like eviction ban time period?
Yeah, we're hearing about a lot about like constructive evictions, and I hear that a lot from our colleagues at places who do eviction law, that they're hearing a lot of constructive evictions happening now. And I definitely think conditions are a way that people are doing that. Just saying like, I'm not doing repairs now, especially for people who may not be able to pay their rent. Like, you're not paying rent, why should I do repairs for you? Are things that people are reporting to us. And so of course they're still legally obligated to do the repairs. So I think that that's been a tension point. I don't know if people saw in the news this week, but Mayor Bowser put in an additional $14 million into rent relief, and landlords are going to be able to access that rent relief on behalf of their tenants. So that should help both tenants and small landlords be able to get funds in to do some of the repairs that they need, I think. So they'll have access to rent that they may need and access to the funds to do the repairs, if that's been some of the problem.
And Kathy, you mentioned how wonderful it would be for folks on this webinar, this call, to, you know, support these efforts. And you mentioned the next session. Just could you talk a little bit about the timing of that and like what might be involved in that support?
Yeah, I mean, honestly, I think it could be as little or as much as people are interested in. I think even just signing on to a sign-on letter or an email from people, we can help give some text and tell you where to direct it to, could be helpful. Or if you're more interested, joining, you know, meetings with council members is certainly a possibility. Obviously all virtually at this point, but I think even just signing on, saying that, you know, who you are, or sending an email from yourself, like we can, like I said, draft some of the text, we have some ready to go, would be helpful. Hearing from different people at this point that they want to move it forward, or depending on what organization you work for, signing on your organization could be helpful in moving stuff forward. But as an individual or as an organization could be helpful, because the council is used to hearing from the same core people, but hearing from new people, they're, you know, you'd be surprised how few people they hear from on issues. So hearing from new people, I think, is always like, oh, there's more people interested.
So I have another question. Clearly this is a softball plant that's coming from me, but can you talk to us about, I mean, like when we talk about educating the council or doing our policy advocacy, I know how important it is for our client families to share their experience. I don't know if you could just kind of, you know, talk to the participants of the call about the work we're doing on that front.
Yeah, we've done some trainings with so we've really tried to step that up. And, you know, I think Tracy and I have both been working directly with some of our clients through the Build Health work who are like full on partners in that work, and like They've been some of the core members who have wanted to, but we've also reached out to a lot of clients just in our cases who have expressed interest in sharing stories, and then really worked with them on developing some testimony, either written or verbal testimony that they've wanted to offer to the council, or they've shared stories to the media or in other formats. Because some of our clients don't want to share their stories, but some of them really do want to share their stories, and they want it out there how badly they were treated and how they had to fight, and they fought with us, and they, you know, got what they needed. And so we really want to help them, you know, share their voice if that's what they want to do, to amplify their voice. And so we work with them in their own words to do that. We did a training last summer on sort of sharing testifying, which we did with Children's National and Department of Health. And we had about 25 parents get trained on testifying there. And then we had people actually testify on the lead law last year. And we had people testify about DCR, quite a few people were interested in testifying about DCRA last year, issues they'd had with DCRA. So kind of along those lines. And I think it's really helpful, again, because the council's used to hearing from us, but to hear directly from the impacted like residents, I think is very helpful to them. So we do try to encourage that for people if they're interested, rather than us sharing their story, having them share their story in their own words.
Right. I do see, this is switching gears a little bit, but a question came in. What about housing conditions in shelters or concerns for people experiencing homelessness? What does Children's Law Center do on that front?
Yeah. I mean, you could answer this as well as me, but we do housing conditions in shelters. So the good news is that since DC General closed a few years ago, we get a little bit less in the housing conditions and shelters fronts, because the new shelters that have been built in each ward are brand new and have had fewer like consistent issues than the other shelters. Mm-hmm. I think in the pandemic, it's definitely been tougher for people living in sort of the congregate living and, you know, in rooms. It'll be interesting. And the DC just shut down the hotels they were using as overflow shelters. So we'll see what happens this winter in terms of where people are going to be living if they overflow those ward shelters. But we do hear a lot of people with conditions in rapid rehousing, which is a program that people get put in after the shelter. They're not technically homeless under DC law, but they're people who have recently been in the shelters and are going in funded through the homeless system into sort of 1-year program. And that program, I would say, is where we get probably the worst housing conditions cases that we tend to see are in rapid rehousing program housing. So it is just private housing, but because it's just a 1-year subsidy, it's hard. People have a hard time finding housing and often end up in some of the worst housing that we see. So those can be really tricky cases, and people sometimes have really, really terrible conditions there. So we do a lot of advocacy in that situation.
Kathy, when you were talking about our Build Health work and our increased involvement with, you know, working with our, you know, parents and caregivers, not just in individual cases, but in trying to understand more from their perspective about needs and ideas for solutions, it brought to mind what I know that, you know, Kathy and I mean, this is very recent, but we, through our Build Health Challenge, we recently conducted a survey of not a large group of client families, but we, you know, conducted a survey of approximately 200, well, we sent the survey out to about 200 families through our Build Health work. So families living in Ward 7 and 8 who who go to Children's National at the ARC for their primary care. Anyway, we're still processing the results of that, but, you know, one of the takeaways, the initial takeaways, from that initial review of the results was that that housing conditions absolutely is a concern. The top issues from the survey, anyway, were mice and rat and roach infestation. And then the other key piece that kind of rose to the top was around distance learning and the demands of that, combined with families' obvious, you know, like concerns about the pandemic. and the fact that they are not confident in a return to school, even if it were offered, and the need to kind of figure out things for families and kids to do. So ideas around safe activities for kids that can get them out of the home, outdoors, that can maybe involve families engaging in mindfulness activities, yoga activities, things like that. And I was just thinking about this whole conversation today about if your home, your apartment, your house is not conducive to learning, what can families do? And I think some of our families, have identified, some solutions that I think as a broader DC community, maybe we're not focused on, which is, some support for parents themselves in handling this new world.
It was very interesting that they identified infestation so highly also, because the other piece of legislation I neglected to mention was bed bug and pest bill that we've been working on that didn't get voted on yesterday, that we're going to try to bring, that I think will be brought back next session as well, that add some specific changes the code to make it easier to get like bed bugs and other insect like infestations resolved. Because right now, technically, before your landlord is responsible, if you live in multifamily housing, you have to show that your neighbor is also infested, which is really hard to do. And it would kind of like resolve some of those issues and just like change some of the technical ways that people can get extermination done. So I think it's reaffirming but sad, unfortunate that that's sort of also a high level priority for clients and tenants that we're seeing in the city, that's a really big issue for them. I saw someone asked about, can we talk more about what's in the specific lead law? We have a whole chart comparing them. So if you, Hannah in the chat posted my email. If you want to shoot me an email, I'm happy to email the chart. It's a lot of technical, like changing of numbers. Like I said, I think the biggest sort of meatiest part of it from our perspective is that right now landlords are required to notify people with children under 6 and pregnant women if there's a lead hazard at the time of lease up, and that almost never happens because they don't know if you're pregnant, or sometimes they'll notify if you're under 6, but sometimes like children come in, and also a lot of times like grandparents or family members care for children under 6 in their home, but they don't live there, and so they didn't get a lead notification, but those kids are getting exposed to lead in that home, but they didn't know it because they didn't have to have a lead notification. So this requires the lead notification for everybody, the lead disclosure for everybody at lease up if there's lead in the home. And it requires affirmative testing for all units at the time of recertification, which is either every 2 or 4 years. And that's at the choice of the landlord, how often they've chosen to re-up their business license. So either every 2 or 4 years, they would do the swipe test. The swipe test is not that expensive. We would anticipate it would just get folded. It's around $200. So we would anticipate that would just get, I think probably folded into the rent at most places, and you would over $200 over, the course of 2 years of rent. I think most people would not notice that in their rent, to be honest. But it's not an enormous cost, and really would increase the safety of kids immeasurably to not to know that there is lead or not know there's lead. I think landlords who are keeping up their units should not have a lot of lead hazards. And this is only for properties built before 1978, which is about, I think right now in DC, it's about 70% of the rental stock in DC, higher in certain wards than other wards in terms of when the rental properties were built. But so only pre-1978 rental units would need to be tested. So that's sort of the broad overview. Happy to send more information if you email me from the chat email address.
Kathy, the bed bug and pest provisions that you were referencing that didn't make, I guess, the conversation at the council yesterday, would that involve, is that a big budget? Is there a big budget
No, I think they
that?
just ran out of time.
Yeah.
Basically, they were trying to like they always in the last session of the year try to pass a lot of things, and I think they just ran out of time to get it through yesterday. It already had a hearing, so it doesn't need another hearing. It would just have to come up for a vote in January, basically.
I wish I'd thought to kind of run our like internal statistics on our housing cases, but bed bugs, roaches, mice, rats, mold, those are the top
Far and away the top. Yeah.
issues far and away. Yes.
Yeah.
We're getting close to the top of the hour. Kathy, do you see any more questions that have come in?
I don't see any additional ones that have come in. If you have any others, feel free to put them in now. But I don't see any other ones coming in from people.
I mean, it would, well, we still have a moment or two to hear some more questions. I think it would be a good time to talk more about steps that participants, audience members could take if they want to continue to support Healthy Together and Children's Law Center. And if there was anything else, Kathy, about, I mean, this legislative call to action is really appealing and something very concrete. So I think that's something that we could certainly, you know, put together some tips if people would like to support this work, this policy work, on things that they could do.
Absolutely. And if you know, if the lead bill doesn't appeal, but the bed bug does, we're happy to have you work on that. Like I think the lead bill is really where we could use a broad coalition. So definitely get in touch with me if that's something that you're interested in, any part of that sort of healthy housing policy work.
And I should also, of course, take this moment to say that, and I think Kathy or I mentioned this earlier, but you know, all of this housing conditions work that we're doing on behalf of families in the district, you know, we actually can't meet the need in-house at Children's Law Center alone. There are too many cases, too many families in need, too many issues to address. And so we do, I think most of us on the call know that we have a very robust pro bono program here at Children's Law Center. And we do place housing conditions cases with, you know, law firms, solo practitioner and government lawyers across the city. So that is another way that people can participate by providing pro bono assistance if you'd like. And if anybody's interested in learning more about becoming a pro bono attorney and handling a housing case or an education case or a custody guardian ad litem case, caregiver case, you can connect with our pro bono director, Jen Massey, and we have a slide up now with Jen's contact information. And then of course, we are always very appreciative of any financial support that anyone can provide. And here on the slide is a link to a way for you to do that. And of course, if you go to our website, we make it very easy for you to provide financial support to us, and we so greatly appreciate it. You know, and I kind of want to say in closing that, you know, I think this conversation really illustrates, you know, the power of the medical legal partnership model. So it's the medical, the legal, the community partners joining together with the patient, you know, the child, the family, the parents, and the caregivers, and we're getting these individual solutions, systemic solutions, and sustainable solutions to really address these health inequities and the challenges that families are facing. So we really appreciate you all joining today. Please stay connected with us, share your ideas and support. And we look forward to continuing to work together. So thank you very much.
Thank you.